Alright, so we're getting into Chapter 6, which is Controlled Substances Part 2, Ordering and Disposal. So how do we order controlled substances? So below we're going to look at the DEA forms, which are related to managing controlled substances that should be known for the CPJE. So we're looking at things like the DEA Form 224, the DEA Form 224A, 225, 363, 510, the 222. That's the most common form that we use is the DEA 222, which is the ordering form to order Schedule II drugs into the pharmacy. We're also going to talk about the 106 and the 41. Okay, so what is the 224 form? So the 224 purpose is it's a registration form for retail pharmacies, hospitals, clinics, teaching institutions, practitioners, or mid-level practitioners. The 224A form, the purpose is that it's a pharmacy registration renewal form. The DEA Form 225, the purpose is that it is a registration form for drug manufacturers, distributors, for example, the suppliers and the wholesalers and researchers. Then we have the DEA Form 363. The purpose is that it's a registration form for narcotics, opioid treatment clinics. The DEA Form 510. The purpose is this is a registration form for bulk chemical manufacturers and distributors. The DEA Form 222, again, this is the ordering form for ordering Schedule II drugs. The DEA Form number 106, this is the reporting form for any theft or significant loss of controlled substances in your retail pharmacy. Lastly, the DEA Form number 41. The purpose of this is to record if you have to destroy controlled substances. So controlled substances, registrants, some information for registrants. Individual persons have to register with the DEA for authorization to prescribe controlled substances, as we know. So practitioners in a healthcare facility, for example, doctors, mid-level practitioners, residents, let's see. They can prescribe controlled substances for patients within the institution, and they can actually use just the facility's DEA number. Facilities participating in the manufacture, distribution, research, prescribing, or dispensing of controlled substances must also register with the DEA. The registration form used depends on the manner in which the applicant will manage controlled substances. After approval of the registration, the DEA will assign the individual or facility a unique DEA number. This DEA number will allow a prescriber to prescribe controlled substances or authorize a pharmacy to order and dispense controlled substances. Healthcare providers practicing at the following facilities can prescribe, administer, or dispense controlled substances without registering with the DEA. So if the prescriber, healthcare provider, is working with the Federal Bureau of Prisons, the Indian Health Service. If they're working with the U.S. Armed Forces, like the Air Force, the Army, the Coast Guard, Navy, Marine Corps, or the Space Force. Also, if they're working with the U.S. Public Health Service. Providers that purchase or procure controlled substances, for example, pharmacists at these facilities, are not eligible for this exemption, and they must register with the DEA. Okay, so then the next section is ordering Schedule 3 through 5. So when we are ordering these medications, Schedule 3 through 5, they can be obtained from a supplier or a wholesaler, like we would order typically from McKesson or Cardinal Health. And we use a purchase order form, and we can also order through the CSOS, which is the Controlled Substance Ordering System, just through the computer. The invoice or a packing slip receipt is used to record the delivery date and to confirm that the correct items were received. The receipts have to be readily available in the pharmacy, and they have to contain the following information. So the name of each controlled substance in the order, the drug formulation, like for example, if it was an oral solution, the number of dosage units in each container, and the number of packages ordered and delivered. Now when we are ordering Schedule 1 and 2 drugs, before ordering these, the pharmacist in charge has to first register with the DEA using Form 224, and the pharmacy registration renewal has to be completed every 3 years using Form 224A. So the Controlled Substance Ordering System, the CSOS, can be used to order Schedule 1 through 5 drugs, while DEA Form 222 is limited to obtaining Schedule 1 and 2 drugs. Schedule 1 drugs have no currently accepted medical use, but they may be ordered for use in investigational research. So here's a chart of paper versus electronic ordering. So for example, when submitting a DEA Form 222, the method of submission for that is paper, but the CSOS, the Controlled Substances Ordering System, that one is electronic. The number of items per order that can go out on the DEA Form 222 would be a maximum of 20. But on the CSOS, the electronic ordering system, it's unlimited. What kind of drugs, again, can we order through the 222 paper form? That one is Schedule 1 and 2 only. Through the electronic CSOS, we could order Schedule 1, 2, 3, 4, and 5. What's the typical turnaround time on the DEA Form 222? This one could take like a week. The other one, the CSOS, could show up in a couple days. What type of signature is used? On the DEA Form 222, it would be a handwritten signature using a pen. On the CSOS, it's a digital signature. So can the order be endorsed to another supplier? With the DEA Form 222, it says yes. With the CSOS, it says no. When must the supplier report the transaction to the DEA? The DEA Form 222 says by the end of the month during which the order was filled. The CSOS says within 2 business days of filling the order. The DEA registrant can request copies of Form 222 or CSOS access on the initial DEA Form 224 or through the DEA website. Each pharmacy location has one designated registrant. This is the only pharmacist authorized to order Schedules 1 and 2 drugs, unless the registrant grants a power of attorney to another individual, allowing them to place orders for Schedules 1 and 2 drugs in his or her absence. A power of attorney is a legal document that authorizes a designated individual to act in the registrant's place. The following provisions apply to the use of a power of attorney. It can be granted to licensed or unlicensed pharmacy personnel. The registrant can grant multiple power of attorneys. The registrant may terminate a power of attorney at any time by executing a notice of revocation. A new power of attorney is only needed if a different person signs the renewal application. The power of attorney should be filed at the pharmacy with the executed DEA Form 222 and must be readily retrievable. It is not submitted to the DEA. Each time a Schedule 1 or 2 drug changes location, like with distribution, purchase, or transfer, DEA Form 222 or the electronic alternative documents the movement. If CSOS is used, the electronic system will trace the drug's movement. A record is needed when a Schedule 2 drug moves from a wholesaler supplier to a pharmacy, from a pharmacy to another pharmacy, or to a reverse distributor for destruction. This documentation is required for every drug movement except in 2 situations: when the drug is dispensed or administered to a patient, or when a central fill pharmacy associated with a retail chain is filling Schedule 2 drugs for one of the chain's retail stores. All right, the next section we're going to look at is going to look at Form 222.